1 in 8 men will face it. It's the second most common cancer in men. But here's the good news. When caught early, prostate cancer has a near 100% survival rate. So what causes it? How can you prevent it? And what are the latest treatments? Let's break it down. Prostate cancer causes, prevention and cure. Prostate cancer starts when cells in the prostate gland mutate and grow uncontrollably. But why does this happen? Let's talk about the key risk factors for prostate cancer. Age is a significant factor. Men over 50 are at higher risk, but younger men can get it too. Family history plays a role as well. If your father or brother had prostate cancer, your risk is doubled. Race is another important factor. Black men have a higher risk and often face worse outcomes. Obesity and a poor diet are linked to more aggressive forms of prostate cancer. And hormones, specifically high levels of testosterone, may fuel the growth of the cancer. Now let's understand how prostate cancer spreads. It starts in the prostate but can invade nearby tissues such as the bladder and rectum. In more advanced stages, it may metastasize to the bones, which is a common site for advanced prostate cancer. A PSA blood test can detect early signs, but it's controversial. More on that later. While you can't control genetics, you can lower your risk with these science-backed strategies. Eat cooked tomatoes as lycopene reduces risk. Cruciferous veggies like broccoli and cauliflower fight cancer. Include healthy fats, such as omega-3s from fish and nuts. Exercise regularly. Active men have a 30% lower risk. Maintain a healthy weight, since obesity is linked to higher risk. Discuss PSA testing, starting at 50 or 45 if you are high risk. Know your family history and consider early screening if needed. No, frequent ejaculations don't prevent prostate cancer, but they don't hurt either. Not all prostate cancers need aggressive treatment. Here's the modern approach. For slow-growing cancer, which is considered low risk, there are a couple of options. First, there's active surveillance, which means regular PSA tests and biopsies. And then there's watchful waiting, which is often recommended for older men with other health issues. For aggressive cancer or high-risk cases, several treatments are available. Surgery, specifically prostatectomy, often utilizes robotic surgery to minimize side effects. Radiation therapy can be administered either as external beam or brachytherapy. Hormone therapy works by blocking testosterone to essentially starve the cancer. And for advanced cases, immunotherapy and targeted drugs are used. These treatments aim to provide the best possible outcomes for patients facing aggressive cancer. When it comes to survival rates, there's some encouraging news. For those diagnosed at an early stage, the 5-year survival rate is an impressive 99%. And even for advanced stages, new treatments are significantly extending life expectancy. It's important to be aware that treatments can cause side effects such as incontinence or erectile dysfunction. However, new techniques are being developed that reduce these risks considerably. Prostate cancer doesn't have to be a death sentence. Get informed, get screened, and take control of your health. If you learned something new, hit like, subscribe for more men's health tips, and comment below. Have you or someone you know faced prostate cancer? Get checked. Download our free PSA test guide today.